good. Therapy helped for a bit, but it just came back ever since I started doing truckloads at work. So I used to be a kickboxer or whatever. Well,
Nice.
I still am, but I stopped for a little bit.
Walk me through it a little bit. It's Isla. Made sure we got her name right. So it's Isla, yeah. Tell me a little bit about the back pain. What's going on?
Okay, so I used to be a kickboxer or whatever. I stopped for a little bit, and I stopped that completely. And like therapy helped for a bit, but it just came back ever since I started doing truckloads at work, and I'm just trying to get my back.
Truckloads?
Yeah.
As in like, are you unloading trucks? Or?
Unloading and then like stocking stuff on shelves from the crates. It's usually towards the bottom, but it's now hitting more like up my spine.
Okay, so feeling it from the lumbars up to maybe like T10 here, a little bit above the TL junction. Never seen a chiropractor before either, first time.
No.
Okay. Any numbness and tingling in your legs, anything like that?
A bit of fatigue in the legs, but usually nothing in the legs.
I've noticed that's bringing your head forward just a little bit here. So, but it sounds like you're up and moving most of the day. You're not sitting a lot throughout the day. So, okay. Any tenderness in here?
A little bit.
Okay. Are you in school?
Yeah, online though, because I'm working 8 hours a day usually.
So we're just feeling for restriction wherever things are tight. And you've got quite a bit of restriction. So you've got a little bit of a curve to your spine. It has a convexity to the left, meaning that when you come down your back, it shifts to the left a little bit here, and it kind of curves back to the right. Sometimes when the joints get restricted, they can become painful because you're not able to fully move through those segments. So what I want to do is go in there and start to release those joints again, get that mobility going in your spine, especially in that area where you're having a lot of pain, so that mid-back to lower back segment. So we're going to try to open that up and do that through adjustments, right? So when I adjust the spine, it'll start to loosen those segments back up. I just want you to stay nice and relaxed for me. I'm just going to drop the head over, just drop the shoulder down. Do a little pressure here. Wow. How'd that feel?
Very good. That was loud.
Yeah, yeah, it was. So just stay nice and relaxed for me here, okay? I'm just gonna let this fall. A little pressure. Wow. Crunching. All right, it's a great start there. So for this one, you're gonna feel this go down the back. You're gonna feel those vertebrae open up and decompress. Just stay nice and relaxed for me, okay? So just nice and relaxed here. Keep your teeth together for me. Breath in, let it out. There we go. How'd that one feel?
It's like hitting into my head now.
How far down the back did you feel it?
Like right here.
So for this one, you're gonna actually lean back on my knee here, and then I'm gonna have you do hands behind your head for me. Good. Okay, we're gonna lift up a little bit, take a breath in, and let it out. Wow. Okay. And you feel that kind of through this area? Did you really know what to expect?
No, honestly, I didn't think it was going to be that crunchy.
Really? No. You thought it might be like one little pop or something?
Yeah.
There's one. Excellent. There's one release. A little more pressure here. Just take a breath in, let it out. Oh my gosh. Crunching. Wow. This is the loudest one of the day. Okay, we're gonna work the left side here. Nice. Now I'm gonna work your hips. Hips play a big role on how your lower back feels and how restricted things can get, so we wanna make sure we mobilize these. Great. Okay, press this elbow back. There we go. That's what we were looking for. Next, I want you to stand up for me. Reach down towards your toes. Okay. How does that feel to you?
Better.
Better?
Yeah.
Better than before?
I mean, it feels a lot looser than it did.
Yeah. Able to reach down further? Which one was your favorite?
Oh. The neck ones are so I think the back, like the twisting one.
That one you felt the most relief with?
Yeah.
Wonderful. Okay.
Not like regular ones.
Yeah.
Like mainly like after a night out.
You ready?
Yeah.
You think you're gonna be pretty crunchy?
I don't know.
Who'd you bring
I think
for...
I'm gonna crunch. I haven't gotten it done in a while.
This is your emotional support friend, right?
That's her.
I got you, girl.
We were wrestling.
All right, here we go. Nice and relaxed for me. And do a little pressure here, okay? There we go.
That actually was nice.
Yeah. Good one.
Nice.
Pretty crunchy there.
Yeah, I am pretty crunchy up.
Just relax this arm. There we go. You hear that?
Yeah.
Let's go. Hands on your hips for me. Push back. There it is. So we're gonna lean back here. I'm gonna have you do hands behind your head for me. Okay, take a breath in. Come up a little bit. Breath in. Let it out. That might be the loudest one I've ever done on that. No lie. That was crazy.
That was good.
That was nice.
Winner. I recommend that.
That was your favorite?
Yeah.
Nice.
That was good.
That one was okay for her. I don't think she loved that one, but
Yeah, no, I like that.
flip to this side for me. There we go.
That was cracked.
Cracked? All right.
Cracked.
That's a good answer. This is the one you were talking about, right? Did you not do your research before you came in here? You
No,
didn't look at the videos?
no idea.
No, I.
Oh,
well,
sugar videos on the way here.
You're like, this is what he's about to do to you.
I'm like, oh no.
We were doing?
I don't know. I thought we were just getting adjusted.
Yeah.
And like,
We're just offering free adjustments. That's funny. Next one is called the decompression. This one you'll feel go down your back, so you feel it all the way down your spine. You feel
Okay.
this down into your lower back. So just stay nice and relaxed for me here. I'm gonna have you take a breath in and let it out.
oh my god.
How do you feel?
It feels like my head came off of my neck and went back on.
It's still on there.
Yeah, it's still on there. I felt it like in my spine, like mainly like lower.
With your relationship, like everything's a secret. There's some inside stories here for sure.
No, we're
Nice one.
that was good.
Sir.
Yeah, I would say like the lower back and like the neck area and like right here are my main problems. But I'm in a desk all day, kind of like hunched over, so
Yeah, gotcha.
that'll do it.
What'd you say you do for work?
Recruiting and roofing,
So sitting, how many hours a day do you think?
probably 8+, depending
8+
on the day.
hours a day?
Yeah.
Okay. So lower back, neck, all from sitting, or you think there's other things that contribute maybe?
Maybe the gym,
Okay.
not the right form sometimes.
Okay. All right. How often do you work out?
I work out like 3 to 4 times a week.
Okay.
Yeah.
Guys are pretty active too.
Yeah.
You get any like numbness and tingling in your legs or arms? Nothing like that. So this side. And that side's a little bit more limited. Look up at the ceiling for me. Okay. Lean your ear over to your shoulder here. Let's go this direction. How do all those feel for you?
I felt that one, felt more tense on this side.
And then face that wall and reach down towards your toes. Okay. Got some limitation in the lumbar here. Stand back up for me. Can you bend backwards? See how far you can go into extension?
Pretty
Okay, that's good. So limited in flexion, not extension. You ever get headaches?
Yeah, sometimes.
Feel them at, is it back
Like-
here?
Sometimes like up here and like a little bit back here, yeah.
Okay. You said you've been adjusted a couple times?
Yeah, I'd say the last time I got adjusted was before I went to college and I'm graduated, so
Okay.
probably a
It's
few
like
years
5+ years ago,
Yeah.
probably. Some tightness on the right side of your neck for
Oh,
sure.
yeah.
Any pain when I press in there?
Yeah, a little bit.
A little bit. A lot of restriction through the mid back there too. Right inside the shoulder blades, right in there. Just relax your head for me, little pressure.
Oh, that was awesome.
Wow.
That was great.
We'll probably release every joint in her neck on that.
I heard it from here. I'm like, oh wow, that was awesome.
When they adjusted you in the past, did you just have like the standard kind of like twist
Yeah,
the neck?
it wasn't anything like that.
This is definitely your tighter side. So just a little pressure.
That one was really good.
Crispy.
Oh,
Those are great. Okay, press your elbow back into me. There we go. Nice and easy. Press back.
Ooh.
Easy. Perfect.
it's like I needed that. That was so good.
Those are ready to go. Perfect. We're gonna come through here. We're gonna lift up, nice and relaxed.
That was
There we
great.
go. Perfect. I think got pretty much every segment on the mid back there too.
Everything you've done is amazing. Love it.
Any pain so far?
No.
No pain.
Not
Everything's
at all,
feeling good.
yeah.
Okay. So this is low back, little pressure here.
Ooh.
Dang. So a little pressure. Nice.
That's good.
It was a little stuck on that side.
Oh yeah.
Back down. So you didn't see the decompression adjustment?
No, I don't
Okay.
think so.
All right. So we're gonna strap your feet in for this one.
Okay.
This one decompresses the whole spine.
Okay.
So you'll feel it go all the way down the back.
Perfect. Love it. Do your thing.
You got it. So just nice and relax for me here. I'm gonna have you take a breath in and let it out.
Oh my goodness. That's
Dang.
crazy. That just cracked my entire spine.
You feel that all the way down?
Yeah, that was crazy. That was good.
Where do you feel it the most? Like neck?
Right here.
Right through the neck? Wow. Didn't expect that much release to still be in there. Good. Nice. You ever pop your fingers?
All the time.
Really?
Yeah.
Did you already do it today?
No.
No?
Not that I know of.
Let's see if we can get anything. There's the elbow. Good. Good. Better on the right side. Okay. Now let's check the lower back again. Can you stand up for me?
Yeah.
Face this wall again. And then bend down towards your toes. Let me see that.
Oh wow.
Okay. Big time game changer there.
Yeah, for sure.
We know extension was already good to begin with, but that's
Yeah.
crazy.
Yeah,
Big
that
difference.
was way more down than it was before.
Nice.
Yeah.
How do you feel?
I feel great. That was awesome.
A little pressure here.
No, that's so scary.
Okay.
That is so scary. I don't know what I was expecting.
Took her breath away a little bit on that.
All right, we're so fine, I think.
You guys will have something to laugh about the rest of the day.
That's scary.
Just got it in.
Oh my god, I don't know, that's so scary.
Let's do hands on your hips for me.
Oh.
Yeah, not close. That was your knee. Press back. Good. Nice. Press back. Nice. Take a breath in for me. And out.
Oh.
That was good.
What is with the sound effects? I don't know what's going on.
Funny.
I don't think you have. Oh, hold on. Her back's pretty tight. Let's see if we can get a little bit here. Okay, good.
Oh.
That was the one.
Yeah, that one did it.
Much better. You ready?
I think so.
Nice and relax on this one. Just take a deep breath.
Oh my god! Ow, that's so scary. Ow.
She broke out. It was great.
Oh my god, yeah, I felt that everywhere.
That was wild.
That was wild. Oh. Oh.
Yeah. Nice.
Why can't I shut the fuck up? So bad. It's a muzzle.
You need muscles and chain restraints.
How do you feel?
I feel amazing. That pressure, like on my lower back, has relieved now, so it feels really good.
Good.
Yeah.
Did you have a favorite?
My favorite? I don't know. They all scared me.
Well, you made it through it now.
Honestly, I feel like it was the first one.
What
Mhm.
about
Or
the
my
Sam?
favorite. Huh?
The Sam one.
The
Yeah.
Sam one is alright.
Sam's special.
I've always had a problem with like my shoulder blades. It was working for a while, for several years, but then when I got pregnant with her, about 8 months, this spot in my neck, I felt it, and just through now 11 years, it's just been getting worse.
So mainly feel it right here.
Right in here, when I touch
okay.
in here, I can feel it all through.
Right on our
nobody-
CT junction.
And nobody's been able to tell me what's wrong. Back in September, I went to a upper cervical chiropractor where they use the machine, and it would feel better for about 2 hours, but then I would get like a raging migraine. Yeah, the migraines, I can feel it like going up my head,
Okay.
and that's where it goes.
Is it tender here?
Yes. It's always tender there. Oh yeah, right there on
And
that
then
side.
all the way around, right? And then here
Yeah.
too?
Yeah, and then I can feel it in my jaw. Like right now I don't. Like today's about like a 4.
In here?
Yeah.
What do you feel there?
Like pressure and tightness. Like it was
Where do you feel it at? Is it here or here?
both.
It's on both
and up
sides.
here.
Okay.
Like I can still feel it up here.
So what I'm getting right now is you've got a lot of sensitivity. You've had some adjustments. The upper cervical adjustment, you know, it only focuses on C1 and C2 here. So you really haven't had this addressed in a while, it sounds like. The approach is going to be a lot different. Therefore, the results are likely to be very different as well. So we're just going to let this fall. We're going to do a little pressure right here. There we go.
Oh. Okay, that wasn't bad.
Not bad?
No, not bad. Like my heart's pounding, but that's
You did great.
okay, good.
Yeah, that was a great release there, so really happy with that. Let's see what the right side feels like. There it is.
Oh,
Had
okay.
to go a little deeper on that side. How's that feeling?
Good. A little surprised. Like my head's attached again.
It's called an A to P adjustment
Okay.
on your thoracic spine, okay?
Okay.
I just want you to take a breath in for me, and then let it out. Good. And again. And good. Okay, let's go one more. Good.
It's stretching. Feels good.
Here we go. Okay, a little bit more. Really good. Same thing, little pressure. Wow.
Oh, goodness. That went like up here.
Walk you through this one. So for the decompression, you're gonna feel this one go down the back. The reason why I said this one was good for you is because your CT junction, it's a really difficult area to adjust for any chiropractor.
Okay.
Because it's a junction. Junctions just seem to get more restricted than other segments. You've got the CT junction and you've got your TL junction towards the lower back. So for CT with decompression, it's right there at C7T1. When I do the decompression, you'll feel the vertebra separate and kind of pull apart. And again.
Oh my goodness. Whoa. That was kind of scary.
Just lay there for a second.
Okay. Definitely released.
What do you
Thank
feel
you.
on that?
I felt it all the way down and probably like up to here, maybe. It's already starting to like feel better right here.
Doing okay?
Yeah,
Felt
I don't
it.
have a headache right now. And that's amazing. I have a headache every day.
Just take your time.
It's almost like my knees feel better too. Is that possible from it?
Obviously, everything in the body is related, right?
Okay, I'm okay now.
No, take your time. This is totally expected, totally fine. You were mentioning a minute ago you felt it through the lower spine. Mm-hmm. And then you felt it in the mid back as well.
Yeah.
What do you feel in the neck?
It was so deep in here, I don't even know if I like felt it up here, but in the neck, it feels softer. Like my muscles don't seem to be like as tight. But it feels better up
This
here.
was a big release.
Yes.
Okay.
Yeah. Right now, like I would normally feel like this when I lay down, like almost like curved. But right now it's like relaxing in here.
Good. You didn't think anything else could be in there, did you?
I didn't.
Nice. That's just lower there.
Okay.
Good.
Wow.
Mm-hmm. These are great too. Good.
This is not even as tight as it was before either. And that one was always in pain. And it's not Like when I touch it, it's softer, like the muscle.
Less intensity.
Yes, exactly. Wow.
How does that feel?
Great. Actually, like breathe better.
It's a crazy feeling, isn't it?
It is.
It's almost everybody says that. Yeah.
To get some changes.
Oh yeah.
So that's a big one.
I heard that.
That was a big one. All right, so lie on your back again.
Uh-huh.
Let me take this pillow away. Scoot to the top of the table, okay?
Okay.
You feel like that gets a little tighter?
Yeah.
How is that?
Great.
Good, a little more.
Mm.
Is that okay?
Yeah.
Good. Let's go back down to the ankle. Scoot down towards me so your heels hang off. And then you can lie back down. Here, I'll give you a pillow so you're more comfortable.
Thank you.
You're welcome. Come another 2 inches, just so your heels hang off. So I'm going to start with the right foot, even though the left one was worse, right, for ankle stuff. Okay, so come in close. Let this relax a little bit. There it goes. Do you hear it?
Yes, I felt it.
Good. It already popped. Did you feel that?
Yeah, I felt the pop.
That one's good already.
Okay.
Good. Lie face down one more time.
Okay.
You can put your hand, yeah. Do a spot in here. Big breath in and blow it out. Wow. Okay, lift this leg one last time. Tell me what you think.
Much smoother.
Much smoother. Okay. So I don't know if we cured it all. Probably didn't. But we did a good session. What do you want to look at today? What do you want to work on?
My lower back and the pain radiates to my heels and
Oh,
my
wow.
calf muscles. It hurts a lot.
Do you feel it every day or just
Yeah,
some days?
every day.
How do you recreate that? Do you have to like bend down to feel it? Or?
No, just even walk. It's constant hurting.
Come stand right now, and what if you kept your leg really straight and touched your toes? Do you feel it that way?
No.
Then do a little walking. Go over there and come back again. And do you notice it now?
No, it's as soon as I get up from lying down for a while,
Okay.
like it hurts here into my sacrum or whatever,
Okay, yeah,
and then
that's the sacrum.
radiates.
And is it both legs or usually just one
this
leg?
one.
Left leg.
Yeah.
Okay. So let's get you to lie face down for a minute and let's take a peek at what we see, okay? So move back towards me and move your arms to a neutral position back here and lift this thigh up as high as you can and then put it back down. And then lift this thigh up and put it back down. This time when you lift your right leg, point to where you feel tension, okay? And I'm going to move your stuff out of the way too, okay? I should have left it in the other room. Here it is. I'm just moving it under this shelf. And you feel it in the sacrum?
Yeah.
Okay, put your arms down. So I'm just going to take a look at your leg length. The left leg's pulling short. Here, I'll put these shoes on so when you look back at the video, you could see what I'm looking at, okay?
Okay.
The shoes have a big white line, and the white line should match up. So we're going to put these on like this, and we're going to hold them together, and the left leg's pulling short. So we call that a left pelvic deficiency. And I'm going to adjust into the left sits bone. The real name for that is called the ischial tuberosity.
Uh-huh.
And so I'm holding this bone here, and I'm going to adjust into that, into the ligament, the sacrotuberous ligament,
That's where it hurts.
and then right in there, right?
Yeah.
It's right there. But let's go back and look at the feet. And I get the feet even. Now I bring the legs up to this position. Does that make it worse?
No, it feels better.
Okay, it's already feeling better. So let me check the sacral base. Yeah, the sacral base is high. So what happens is this is flipping up a little bit.
Oh,
So I want to push this back down and get on that. Now, how about now?
yeah, feels good.
Okay, so watch this. We're going to do something else, okay?
Oh,
One more time. Good, got it.
okay.
Now, that shocked you, right?
Yeah.
But feel how this feels like now.
Yeah.
Do you see that? Now lift this leg up. And look how high it comes
Yeah.
up. Now lift this leg up. It's already feeling a little better, right?
Yes. So
Good.
much better.
You know, it's sitting at the computer too long without getting up more often.
Okay.
So if you're sitting working on the computer and 45 minutes went by, then you should stand up and move around.
Okay.
And then sit back down again.
Okay.
But even like sometimes you could just even look at the computer screen and just move. If you haven't, like let's say you're studying something or you're, you know, contemplating something and you're not actually working and typing, you could just stand up for a minute and just kind of
move.
sway around and move and stretch your body and then sit back down again.
Okay.
Because we have a lot of time when we're just kind of staring at the computer
True.
and not being active.
Yes.
So that's, remind yourself, well, get up a second and you can actively stare at the computer from a standing position.
That's right.
So I want to check this next. So hands on your lap. Yeah, so this is all tight in here. Do you feel how this is all tight? So I'm going to do an adjustment on this now, okay?
Okay.
So I'm going to actually, I have to get a little higher than you for this one. So you're going to turn your head this way. I'm going to put your head right in here. Let the shoulders fall. Do you hear it pop?
Yes.
So now turn this way. Let your head fall this way. One more. Good. So now scoot back towards me. I'm going to take the arms like this. Put them up on your own body. Let me raise the table just a little bit. Create like a little roundness in here.
Okay.
Now lie on your back right here. Everything's popping on you today,
Yes.
right? Look this way with your face. Keep looking that way.
Oh.
Look this way with your face.
You're amazing.
There's more, right? So you're gonna help me sweep your hair through this, okay? I can't remember if you did this before.
No, I haven't. I think it's the new.
Yeah. All right. So we just want to feel a tug a little first, okay?
Okay.
Do you feel it stretching?
Yeah.
Okay, big breath in and blow it out.
Wow.
Where'd you feel that?
Right here.
More out of the neck. Right?
Yeah.
You had more in the neck than you thought. Did it make a popping noise or just stretch?
A big popping noise.
Yeah. How does it feel?
Very good.
Good. So now you're going to lie on your side facing me this way, please.
And it also did something here.
It opened up the base of the neck and
Yeah.
around the scapulas gets tight from being at the computer all the time.
Yeah.
And texting.
That's true.
Yeah. Because when we text, our head's down.
Mm-hmm.
Bring this top knee like this. I'm going to put my hand through like this and get your low back.
Mm-hmm.
Good. Let me drop this down even more. Good. Go to the other side, please. What'd you feel on that one?
I felt it all here.
Yeah.
And even up here a little bit.
How many went?
Huh?
Like 10 of them.
Yeah,
right?
like 10 of them.
I think you're the popping champion today.
You're very strong.
Wow.
That was a lot.
That was a lot. Lie on your back, please. Whew. You all right? You're like, what the hell did I sign up for? All right, let's look at this one real close, okay? Got it. That was a loud pop. All right, those are good. Let's leave those, okay? Come stand. Come all the way over here. Let me check your wrist too. So you turn this way. Your elbows go a little hyperextended.
Yeah.
Wrists are good. Oop, that one went.
Mm-hmm.
What do you want to work on today? What are your spots?
Well, there's something where the coccyx bone slips up because I sit at the computer and it's all on this left side, all the way down to my ankle. It's like numb, feels weird.
Okay. Does it hurt in any specific position, or if you're walking or standing or jumping or?
This hurts constantly.
Okay. Do you feel it right now?
Yeah.
Okay. Stand for just a second and turn with your back this way and point to the spot that you feel the most.
Right here.
Yes, you are pointing right at the coccygeal sacrococcyx area. Okay, so I'm going to have you start face down. Put your nose right in here.
Okay.
And I'm going to take a look. Good. And I'm going to move your hair off to the side. There you go. All right. So the first thing I noticed is this whole hip is like jacked up. So it's hard for you to lie flat almost, right?
Yeah.
Because it's off balance a little bit. Does one side hurt worse than the other?
Yes, this side.
Okay. So here I am on the edge of the sacrum. I'm coming down.
Right there.
And this is where it gets really tight. So that's the lower part of the left SI joint. And I'm going to roll this a little bit and see what that feels like. I'm going to rotate the leg, and then I'm going to rotate it this way. So I'm internally rotating it and externally rotating it and internally rotating it. We call this toe out, toe in, toe out, toe in. Let's look at it again. Now I'm kind of at the end here. I mean, the coccyx tucks under, so we're not going that far down. But I can be on the top of the coccyx and get a little bit of pressure and leverage in on there. But that hurts, right?
Yes, it does. A lot.
Okay. So there's a leg check that I know from the activator technique that's kind of interesting to see. The legs are even. And now squeeze your buttocks really tight. And look how the right leg goes short. And then relax your buttocks. Good. And here, film up so you see what she's doing too. Squeeze the buttocks and then relax the buttocks. Okay, so watch the feet again. So the feet are even. Squeeze the buttocks. Relax the buttocks. So as I pick the legs up, the left leg is longer, so it is a left deviation. And this is just a cool test. So I'm actually going to use the activator for this. Now, people watching will go, well, you know, you could do, there's manual techniques, but, and they've been around for a long time, but as much as people want like big fun things to watch on the video, you know, first I'm a doctor and first I'm trying to help patients. I'm not trying to create crazy wild videos all the time. Sometimes I am. I'm on the left cornu of coccyx, a little horn, a little cornucopia horn of coccyx. I'm going to put it on a fairly light setting because it's not a big structure and adjust it. Good. Let's go back and recheck. So come down here and look at the feet again. So we know the feet are relaxed, and now squeeze the buttocks tight and relax. Squeeze the buttocks tight and relax. So I took the pressure off that nerve already. Now I also want to see if we have a deviated sacrum. So I'm going to bring the legs up to position 2, then bring the legs back down. But I'm curious to see what happens. But come sit up again.
Okay.
Because I'm going to look at your neck anyway when you're sitting in a seated position. But see what the coccyx feels like now.
I feel like you relieve pressure.
Yeah, I mean, I moved it off. The bottom of the spinal cord, so the spinal cord, you know, starts all the way up at the top here by the brain, right? At the brain. And it comes all the way down. And then by the time you get to the lowest part of the lumbars, it turns into like these long, stringy tendrils, right? It's not so much a cord anymore. And it's also named in Latin, cauda, which means tail, and quino, which means horse, like horse's tail. So it literally looks like a horse's tail. And those tendrils anchor all the way down to the coccyx.
Yeah.
So when the coccyx is deviated or disrupted in any way of its normal position of ease and alignment, it's going to put a lot of pressure on the whole spinal cord.
Okay.
And it can even give you a headache.
Yeah, it does. It gave me even through my neck.
Because the cerebral spinal fluid, and there's just a few, you know, ounces or cc's in the brain, but it comes down the little shaft of the spinal cord, and it repumps back up, like on a hydraulic system, back up to the brain. And so if the coccyx is disrupted, it literally can cause pressure and a disequilibrium of the state of homeostasis of the cerebrospinal fluid, and in effect give you a headache.
Yeah, it did.
Or compound a headache.
Yeah.
So how do you feel right now?
I feel like pressure has been relieved.
Okay, so that's all I did was just tap the coccyx on a very low pressure setting. Didn't look like much, but I probably helped the patient without being invasive. Like I didn't have to have her take her clothes off or touch her in any way and make you feel uncomfortable. So I feel proud about that.
Okay.
You know, to do as little as possible, but also to be effective. All right, so we're gonna do this one next. Maybe move your hair all the way to one side like this. And I'm gonna stand behind you. Scoot forward a few inches. And I'm gonna turn your head all the way this way. I'm gonna drop my arm this way, and you're gonna bring your head over the top like this. Let the shoulders sag. It's a little bitty one. Did you hear it?
Yeah, I did.
Didn't make a loud one, but didn't you hear one?
Yeah, it did.
This one's gonna be louder because this is where you have all the pressure.
Yep. Felt it. Feels so good.
Okay, good. So now lie on your back.
Yeah.
Scoot down this one just a little bit. A little more. Good. So now lie face down, please.
Okay.
Move the hair off to the side again. Thank you. I'm going to grab the skin here, okay?
Okay.
Got it. Those are all good.
Okay.
Drop your arm. Big breath in and blow it out. It still feels tight in here. Okay. Lie on your side, facing me this way.
Facing you? Okay.
Straight, straight. Right there. Hold on tight.
Okay, sorry.
Got it. Drop the knee down now, towards the floor. Like this.
Oh, sorry.
You're just going to point the knee towards the floor. Got it. One last one. Come this way now.
Feel it.
So trying to release pressure all in that pelvic area, the
Yes.
sacrum. Lie on your side. We're going to mirror image to this side. Do the
Okay.
same thing again. Bend the top knee up like this. Pull this through. So now we're going to go back in and do the same thing again. Let me put my arm through. And
Sure.
you hold on to that tricep. Bunch my hands there, okay?
Okay.
That's it. Got it.
That's it. Yeah.
Lie on your back. How did that one feel?
Much better.
Good. I'm curious to see how that pressure feels over the next
Yeah.
48 hours. I think it's going to take about 48 hours.
But I feel like an instant relief.
You did?
It was constricting all the way, like you said, all the way to my brain.
Well, good. So I'm going to do this ankle first, okay? Got it. Firm, good. And tilt your head back, hold your arm firm, good. Keep it firm, make it strong, good. Now tilt it down a little bit and make your arm firm, good. So relax your arm a second. So I just checked her in a couple of neutral positions, like neutral forward, extension, flexion. Now we're gonna go into the side of pain. I'm gonna laterally flex. Laterally flex is just sideways. It's ear to shoulder. So don't rotate, just come straight this way, like that. Now hold your arm up and keep it firm. And it can't, because this is compromised on this side. And she knew that, but I just want to see so that I have a before and after I work on her. So now we're gonna bring it this way, and that opens up the facet here. That opens that up and hold strong. So that side shouldn't be a problem. So when we close the facets and make them worse, make them more crimped, more pinched, more compressed and pressurized, then she loses power on that side. So first I'm going to just massage into the muscles just a little bit, because this feels like a piece of concrete. And you feel this too. You probably have rocks here all the time.
Yeah.
And she's athletically very supple. And that's what we really want in a muscle. When you're not using a muscle, we want it to be taffy-like. We want it to stretch and be supple and be like more like clay or taffy. But sometimes a muscle that's been irritated for a long time feels like a piece of rawhide or beef jerky. And sorry to call your muscle like beef jerky, but that's what it feels like on this side. But the good side is no problem. Look at that.
Yeah.
That's beautifully supple, like a muscle should be. A muscle not used should be soft. And so I'm just digging this out, digging this out, digging this out. And I'm going to stretch a little bit too. Okay, so I'm stretching and stretching. Good. So now I'm going to motion into these joints. I'm not adjusting yet. I'm just getting it supple and ready. Right in there is so bad. Do you feel that? That's one of the worst spots. So this is a harder to get adjustment because it's through the trap. Like there's much more exciting pops I can get up top where I would just crack and you go, wow, I heard the crack and it's amazing. But it's not the spot that needs it. The spot that needs it is really low. It's down here at the base of the neck. Well, let's see if it does release, okay? Yeah. Take a breath in and blow it out. Check that, okay? I don't expect it to be healed, but let's see if we get some of the power back, okay? And we're gonna redo it. First, we're gonna test you neutral, just to see what that arm feels like. Good, so we know we have a strong arm to begin with. Now we're gonna laterally flex it to the bad side and keep your arm strong. Hold. Big difference already, right? So now we're gonna laterally flex, rotate, and bring it back, which is coupling the worst segments. Hold. And it's not quite better yet. So the next thing we're gonna do
It's that amp.
is right in here. So turn around. She still has, so we got part of it already. And to be honest with you, that's really bad.
That's it.
So to be honest with you, we might need a few visits on her, but let's see what else we could do, okay? So right here is the first rib. I'm feeling that rib come right out of the T1 area. And I'm gonna use this instrument, and now come up higher towards the neck. Okay, good. Now we're gonna laterally flex, bend, and take it back. Hold your arm. That's nice. So that's good for a first visit, if I do say so myself.
So
What do you think, Ella?
So much better.
Yeah, it's cool,
Like
right?
rotation. It's still obviously it's still got a little bit up here, but
It needs work, but this is
Needs work.
fixable.
Yeah.
And, you know, I would say, you know, to come do a few treatments if you're interested,
Yes.
but you're going to do fine. You're going to go
Like that.
really rapidly. You'll probably feel, by tomorrow, you'll probably be 60, 70% better from one treatment. Because you're already in great shape. You just have that one spot that has
I've
like,
popped this out years.
yeah, it's just really bad. But your shoulder blade's out too. So we have a few more fun things to do. I'm going to have you lie on your back here. You're going to be close to this edge because there's more to that
The
complex.
shoulder?
Well, underneath. This is out also.
Yeah, because I broke my arm through here.
Is it? Yeah. So I saw that already. No, stay flat on your back. And I'm going to keep your fingertips here. I'm going to put my hand in like this and sneak my hand under here. And you can feel that set.
Yep.
So it's another part of it.
Mhm.
Now I'm going to have you lie face down again. Well, I didn't have you lie face down yet. But I'm gonna have you. Line your side facing me, please. Move close to this edge. Put your hand up here like this. I'm going to stretch this leg straight and this one bends. I'm going to put my hand under here and I'm looking for the lumbar. Right in there. Wow. That was cool.
That was great.
Come this way. Come closer to me. Switching arms. Hand goes in. Pulling up the knee. Let that fall again. There's one more. Let it roll towards me. Can't?
No, it's tight here.
Okay, so let's leave that one. Scoot over this way. 1 second though, you do have 1 or 2 pieces to work on. Yeah. So lie face down now. I'm gonna have you lift this thigh off the table as high as you can and put it down and lift this thigh up as high as you can. Which one hurts more?
This one at the moment, I think it's just muscle.
Yeah. So I'm gonna lean into that with my elbow, okay? Now start to lift that right leg up again, okay?
Can't.
I know, but just do 1 inch or 2 and then put it down and lift it up 1/2 inch and put it down and lift it up 1 centimeter and put it down and 1 more, lift it up.
Oh.
There it is, that's what I was looking for. So one of the things that we do when you're in the office on a regular visit, sounds like I'm selling you something, but we have a 10-minute station before you see me where you get all this worked out with a hypervolt.
Oh, I knew that.
Yeah, and that really is a nice addition, especially in you that has these tight glutes. But I'm hitting it a little bit right now.
Yeah.
And I will hit it for a few seconds of the hypervolt to give you that experience. I know you know the hypervolt, but it's fun to have someone do it to you rather than reach behind you, try to do it to yourself. That's the lightest setting.
Oh, that's so painful.
Now, sometimes we add rotation with it, so we floss the muscle with it at the same time. But you need a lot of work with this, okay?
Yeah.
So now lift that leg by yourself. How does it feel now?
Better.
Good, so lie on your back. So all the stuff that you have is fixable. The neck is a long-term chronic thing, but it's still fixable. And I'm just gonna look at the last thing. I just wanna see what your feet look like.
Some issues, neck, mid back, lower back, legs, right? Tell me about your issues. So what's going on?
I was a very excessive worker in my younger years. I wasn't fortunate to have a lot of things, so I worked a lot. I did about 2 or 3 jobs at a time usually. And apparently it just put a lot of strain on my back. I just recently found out about 1.5 years ago, I want to say, that I suffer from a deteriorated disc, which causes me another issue with pinching on my left sciatic nerve. And that runs the pain all the way down into my left leg, which is also not any fun because I've had 2 knee surgeries on that leg as well. But it bothers me a lot. It's really numbing. It's paralyzing even at times. Very hard to move, very hard to get up out of the bed. But you know, you do the best you can. I try to do as much therapy on it as I can, but it's really a consistent issue that I deal with.
Basically, we went over the x-rays and, you know, mainly the degeneration is in the L5, S1 level. And because of the level of degeneration, you know, there's a limited amount of things that we can do because once we can't really bring the disc back, basically,
Yeah, of course,
you know.
yeah.
So that's why most of the time they'll suggest surgeries, infusions, and so forth. Okay, so that's why we usually tell people to come in and get chiropractic treatment so they can keep their range of motion and keep their mobility at a stable level.
Okay.
You know, so really chiropractic care is mainly preventive. You know, although it does help as far as, you know, when you're having your aches and pains and so forth. So today we're going to do a few things to kind of assess and see what's going on.
Okay.
All right, and then we'll do some chiropractic adjustment for your whole spine, neck, mid back, lower back. Okay, and then we'll put you on different types of treatments like massage to kind of help with the muscles. So I'm going to have you bend forward, try and touch both feet, and let me know at what point you start feeling aches and pains. Right about there. Okay, gotcha.
Yeah.
You feel anything shooting down, like for example, like any radiating pain down the leg or anything like that?
It's more of like a strain.
Gotcha. Come on back up. Come on back up. All right. So let me have you go side to side and let me know if you feel any aches and pains or any radiating.
Bending or just
So you're gonna go this way and that way.
Yeah, that hurts there.
That's as far as you go with that. Okay. And let's go to the other side.
That feels
That's as
good.
far as that actually feels good. Okay.
For the other side. Yeah.
Gotcha. All right. The neck and upper back is not too. They're not too bad, right?
Not at all.
It's mainly the lower.
Yeah. Any pain I may get in my upper back will just like kind of be a little crampy pains if I'm laying a certain way or whatnot.
Gotcha.
But not as bad as my lower at all.
All right. Let me have you kind of extend a little bit. I know extension is uncomfortable for you. Is that tight in the mid back?
Yeah.
Yeah. Okay. All right. Okay, that's uncomfortable. All right. Now let me have you bend forward. How's that?
I don't have much strength there.
Okay. All right. Let me have you go backwards. All right. That's still uncomfortable, right?
Yeah.
All right.
It's like pressure.
So I'm gonna add a rotation component to it. So I'm gonna have you cross your arm like this for me, and then I'm gonna rotate you and then bring you back, and then let me know if you feel any relief or if you feel, you know, aggravation. That's uncomfortable because you're resisting me. So all right, okay. And let's rotate this way. And let's bring that back again. That's uncomfortable and sore as well.
Yeah, and not a lot of strength to hold myself up.
Okay, all right, you can cross your arm. So relax.
Yeah, I feel a little nervous, but
You'll be all right.
I'm a G, I can handle it.
Good. All right. Good.
Wow.
All right, come on up. Let's see how that feels. Good. Move your neck around. Let me know how that feels.
That feels great. I'm even just saying it. It feels great. I've been so stressed. Wow. That's all it took?
Feels amazing, right?
But don't try it at home.
Right, yeah. So they gotta be licensed.
Leave it to the professional.
Is that comfortable for you? All right. So what I want you to do is relax for me, okay? All right. So I want you to relax, okay? Good. Okay, perfect. All right, let's go to the other side, do the same thing. Relax. Good. Okay. All right. All right. Come on back up for me.
Uh-oh.
It's okay. I'll fix
Messy.
that. Yeah. Let me help you up there.
Ooh.
Okay. Just kind of like move around again. Let's see how you feel. All right.
Feels a little loose.
Right.
Yeah.
More range of motion, right? Okay. All right. Take a deep breath for me and blow it out. Out. Good. Again, deep breath. Out. So I'm gonna fix you up. I'm gonna bring you close to the end of the table. Keep coming, keep coming. There you go. Good. I'm gonna twist you up a little bit. Good. And I'm gonna bring your shoulder like this. So keep coming closer to the end of the table. Keep coming. Good. You won't fall off, so don't worry.
Okay.
All right. Good. All right. Just relax as much as you can, okay?
Okay.
Good. Relax, relax. Relax, 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 relax. Oh, there we go.
Ooh.
Felt it, right?
Yeah.
Yeah. Oh, one more time. There you go.
Woo. Oh wow. Wow.
You got all kinds of movements now that you didn't have before, right?
I know when you heard that.
Yep.
I'm like, oh wait. Oh boy.
Yep. There you go.
Yeah, that felt great.
It's like instant.
Yeah.
No. All right. Both legs straight for now. And I'm going to bend this leg and go all the way. There you go. Good. Good. So I want you to relax. Good. There you go. Perfect. Yep. That's it. You felt that, right? Yep.
Yeah. I already feel so, much less stress. Like
Let's have you move around for me. So stand up. Let's have you move around. Tell me how you feel.
How Auntie look shy. Oh, good.
Yeah. So that's much better, right? Yep.
That's a lot better. Wow. I feel even a tiny bit more strength in my core.
Right.
Obviously not. I don't think the strength is going to build up now, but it's allowing me to be in, because one of the reasons I don't do a lot of core exercise because it's extremely hard. It's painful. I don't even have the motion, or just the strength to try to sit there to start the process of it. This is at least allowing me, to move a little bit better, and
Let's go side to side.
Awesome.
Remember, side to side was a bit uncomfortable, so let's try going side to side and see how that is. All right. So you're moving a little bit better. Still a little tight, but it's better than before, right? Yeah. Good. Now the main one was extension. So when you went backwards, it was uncomfortable. So let's just try it. Okay. How's that? A little bit better.
It's a bit more tolerable.
Gotcha.
Yeah.
Okay, perfect.
There was a lot of tension in my back neck area, a lot of it, and honestly, it's all gone.
That's good.
It's really all gone now. It's been very tight. And I try to sit at home and massage it with some rubbing alcohol, thinking that'll help loosen it up, but it doesn't really work as well as I now see it should.
Trying your own home remedy, I guess, huh?
My grandmother told me that, a little rubbing alcohol, and then, I'll follow it like a little icy hot or something.
Oh. Practice out there, though. So I'm gonna examine you first, okay? I just want to see what type of movements you have, what's causing you pain, and your progression basically. After the assessment, I will do some adjustments, but it's probably gonna be limited to certain things, given the history.
It's good. You're gonna pop me. You're gonna do me just like you do everyone.
Like I do everybody else.
Yes, you are. I want the full dance. No, I'm not getting that. No, I want it all.
Yeah, but we gotta make sure that it's safe, though.
We good. We good. Last time you told me no. This time you gonna give me.
Yes. All right. So let's examine you first, and then we'll go from there. Okay. Let me start with start with a lateral flexion. Let me know when things starts to get tight or uncomfortable for you. Not too bad?
No.
Not too bad. Let's go to the other side.
Stop trying to treat me like I'm a baby.
That's okay? Mm-hmm. Okay. Let's have you go forward for me there. Okay. Let's have you go backward. Okay. All right. I'm going to apply a little bit of pressure. That's fine?
Mm-hmm.
Pressure. That's fine?
Yes.
Pressure. That's fine, right?
Mm-hmm.
And I'm gonna bring you back. How's that? That's okay?
Mm-hmm.
Okay. Let's have you rotate again. Good. Let's bring you back. Extend. Okay, that's not too bad.
No.
Okay, so you're actually doing your progression is really good. Apply a little bit of pressure here. How's that? Is that okay?
Mm-hmm.
Okay. That's okay?
Yes.
That's fine. Okay. This is fine.
Mm-hmm.
Okay. Let's lift this whole leg off the table. So bring it up for me. Keep it straight. There you go. And bring it down. All right. What did you feel with that? Was that okay?
Yes.
Yeah? Same thing on this side. Lift the whole leg up. Bring it down. Okay. What's going on with that? What did you feel? Tension in the lower back?
Yes.
All right. We're going to do that movement again, but this time, when you lift the leg up, I'm going to press down and you resist, okay? Don't let me push it down. You understand?
Okay.
Okay, so lift the leg up. All the way up. I'm pushing down, resist. Okay, let it go. Was that uncomfortable? I hear you straining a little bit.
Yeah, I had to relearn how to walk. Yeah, I got some strength, but
it's getting there. Okay.
Yeah.
All right. Same thing on this side. Lift. I'm gonna press down. Okay. Let it go. All right. It's a little bit of weakness, but it seems as if it's getting better though.
Yes.
Right? Let's have you bend forward. So you're gonna bend, try and touch both feet, and you let me know what you feel. What's going on? Okay. Come back up. What do you feel? What's going on?
I feel it here.
You feel it in the lower back?
And
then
the top.
And then the top. Okay. All right. I am going to do 3 adjustments, okay? I'm going to do adjustments for your low back, for your mid back, and then for your neck. Okay? You will not get the Y strap, okay? You know what that is, right? That's
yes,
No, we're not doing that. The reason why is because you had an injury, and given the history and things like that, it's not recommended because it's just too aggressive. Good. Relax. Yes, man.
Yeah.
That was good.
Yes.
How did it feel?
I feel refreshing.
Refreshing?
Yes. I felt the tension lift from the back.
I see. So less tension.
Yeah, I have been having pain like in the back, like when we tie our scarf. I thought that it was from the scarf, so it's from there.
Okay.
Yeah, okay, come on next.
Go on next, right? Okay, relax. Let everything go for me. Good. Relax.
Ooh, fuck.
Ooh, that one was really loud. How do you feel?
I feel good.
You should feel loose.
Yeah.
Yeah, like you're melting, right? Okay, that is it. So basically you got 70% of whatever, the folks that you see, the other 30 we can't do, okay?
Yes.
Get up, move around for me, let me know how you feel. You should feel loose. Oh, okay. You're showing off now, right?
Yeah, good.
Not too bad?
Yeah, good.
Okay, have a seat.
All right.
All right, so the next thing we're going to do exercises that I want you to do. We're going to do some stretches, and I'm going to show you certain things to do at home, okay? That's usually the part people don't like, because they don't like to exercise. And then after that, we're going to do the massages. Shaquan will take over. That one people like. So most people, they like that, the adjustments, the cracking, and they like the massages. They don't like to exercise. But the most important part, actually, is exercising. To strengthen your muscle, you stretch to kind of relax the muscle. That way you don't have to come to me and pay me all this money. There you go. Perfect. What you want to do is lift the lower portion of your bottom upward. Good. And then you want to go up and down motion. Very slowly, though. There you go. Good. There we go. Perfect. Good. Good. How does that feel?
It feels
It's not like super comfortable, but it's not meant to be super comfortable, right? It helps decrease tension. All right, you can go ahead and come up. And what we're going to do, look, your glutes, your bottom, try to make them touch your heel, okay? All right, good. And then what we're going to do is kind of like lean forward and slide. So deep breath, out, slide forward. There you go. Good. Okay. Now
you're gonna help me get back up.
we're gonna help you get back up. We're gonna do that again, but this time you want to try and keep your glutes down while you lean forward. Lean back. Good. And you want to slide forward. I know you got too much, right? Yeah. Let's lean forward. Good. Take a deep breath first. And lean forward for me. There you go. Good. Slide. Try to keep the bottom. Yeah, there you go. Perfect. Yeah, now it becomes a bit harder, but at least you're targeting the area that you need, okay?
Yes.
Let's have you come back up. Okay. On all fours again. And it's so the motion is inward, outward. So I'll do it first. So what you want to do is head down, bring that upper body upward, okay? So it's more like stretching. So down. There you go. Good. All right. And then the opposite motion. Nope. You keep your arm straight. This goes inward. Lift the head up. There you go. Good. All right. So it's kind of like this motion, that, and that. Okay?
Okay.
All right. So let's do that one more time. Good. Head up. Good. And then after that, we're going to go the opposite. So in. There you go. Perfect. Okay. I want you to relax. You can drop the leg. I got it. Okay? I'm going to bend it. Good. And I'm going to go ahead and stretch you out. Just relax for me. Good. There you go. Perfect. If it gets too tight or too uncomfortable, you let me know, okay? All right, just go ahead and relax. Deep breath. And go ahead and let that out for me. There you go. Perfect. Good. All right, nice. Okay. And that's the key. When you're stretching, you want to try and relax, even though it may be a bit painful, okay? All right. We're going to do that again.
Okay.
There you go. Good. And actually, I have to go the opposite arm. All right. There we go. Good. Okay, perfect. Okay. Relax and give me this arm. Good. There you go. Good, good, good. Relax. Yeah, relax. Good. Okay, we're going to do it again.
Okay.
But try your best to just let everything go, okay? Deep breath. Deep breath. And let it out. Relax your body. There we go. Good, 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 good. Yes. Perfect. Okay. Good. How was that? Not too bad?
No.
All right. Good. Yeah. There we go. Good. It's a good stretch though. It gets both areas. Give me the hand. There you go. Good. Deep breath. And out. There you go.
Goodness.
Yes, ma'am. Yes, ma'am. All right. How did that feel? Not too bad?
No.
Okay. What we're going to do, reach for both feet for me. And I'm going to go ahead and bring you forward. There you go.
Oh,
Yeah. There you go. Nice. You should feel it here and you should feel it here.
Yeah.
Okay? There you go. Nice, nice. Right there. Perfect. Good.
Oh.
Uh-huh. Mm-hmm. Good. Yep. All right. There you go. Perfect. And go ahead and let it out. There we go. Nice. Good. Perfect. Good. Let's go one more time. I'll tell you when. Deep breath. And go ahead and let it out for me. There we go. Nice.
Nice, nice. Good. Okay, perfect.
Just say Shaquan got the hands. Spirit finger. That's right, Shaquana. Go ahead, get in there. Go get in there. Oh. Yeah, Shaquana. Push that button. Push that ass. See, this is why you are the best chiropractor. There's not too many chiropractors that does the adjustment and does the stretches and the massage.